Hello and welcome to another episode of Med Madness, the podcast where we dive deep into critical medical topics to help you prepare for the USMLE Step 2. I'm your host, and today we're exploring a severe and life-threatening condition known as Hydrops Fetalis, or fetal hydrops. This condition can lead to significant fetal and neonatal morbidity and mortality, making it essential for us to understand its etiology, diagnosis, and management. Next, let's discuss what Hydrops Fetalis is. Hydrops Fetalis is characterized by abnormal fluid accumulation in at least two fetal compartments. This could include ascites, skin edema, pleural effusion, and pericardial effusion. Imagine seeing a prenatal ultrasound where the fetus has echolucent abdominal fluid, generalized skin swelling, and even fluid around the lungs and heart. Additionally, you might notice polyhydramnios, which is defined as having a single deepest pocket of amniotic fluid measuring 8 centimeters or more, along with placental thickening due to intravillous edema. Now let's delve into the etiology of Hydrops Fetalis. The causes of Hydrops Fetalis can be broadly categorized into immune and non-immune origins. Immune Hydrops Fetalis is often due to Rh alloimmunization, where maternal antibodies attack fetal red blood cells, leading to severe anemia and heart failure. However, in our discussion today, we will focus more on the non-immune causes, which are varied and complex. One significant non-immune cause is Alpha-Thalassemia major. This genetic disorder occurs when there is a complete loss of alpha-globin chain production due to the deletion of all 4 alpha-globin genes. Normally, hemoglobin in adults is made of 2 alpha and 2 beta chains, while fetal hemoglobin is made of 2 alpha and 2 gamma chains. In Alpha-Thalassemia major, the absence of alpha chains leads to the formation of gamma homotetramers, known as hemoglobin Barts. Hemoglobin Barts has an extremely high affinity for oxygen, more than 10 times that of normal hemoglobin, which prevents the proper release of oxygen to fetal tissues. This results in severe fetal hypoxemia, high output cardiac failure, and ultimately Hydrops Fetalis and intrauterine fetal demise. Next, let's talk about the differential diagnosis. While discussing Hydrops Fetalis, it's crucial to consider other conditions that might present similarly. For instance, achondroplasia can also present with Hydrops Fetalis, but these fetuses typically exhibit macrocephaly and shortened long bones on ultrasound. The normal biparietal diameter and femur length seen in our current case suggest that other etiologies like Alpha-Thalassemia major are more likely. Moving on, let's discuss the clinical features and diagnosis. Diagnosing Hydrops Fetalis involves a detailed ultrasound to detect fluid accumulation and structural abnormalities. Additional diagnostic tools include middle cerebral artery Doppler to assess fetal anemia, fetal echocardiography for cardiac evaluation, maternal serology to check for infections like parvovirus B19, and genetic testing for conditions like thalassemias and chromosomal abnormalities. Next, let's discuss the management of Hydrops Fetalis. Managing Hydrops Fetalis requires a multidisciplinary approach. Intrauterine interventions might include fetal blood transfusions to address severe anemia and procedures like paracentesis or thoracentesis to relieve significant fluid accumulation. Delivery planning is critical and should be based on the fetal condition and gestational age, with preparations for immediate neonatal intensive care support. Now, let's consider a real-life case study to bring these points into perspective. A couple of years ago, a 28-year-old woman presented for her routine prenatal visit at 28 weeks gestation. An ultrasound revealed her fetus had significant ascites, skin edema, and polyhydramnios. The fetus also showed signs of placental thickening. Further investigations ruled out Rh alloimmunization and congenital infections. The parents were then tested for thalassemia traits, revealing that both carried the Alpha-Thalassemia minor trait with the CIS genotype. Genetic testing confirmed that the fetus had Alpha-Thalassemia major, with complete loss of all alpha-globin genes. The medical team quickly coordinated a plan for intrauterine fetal blood transfusions to manage the severe anemia. Despite the interventions, the fetus continued to exhibit signs of Hydrops Fetalis. The parents were counselled extensively and a plan for early delivery was made. Unfortunately, The fetus developed complications, leading to intrauterine fetal demise at 32 weeks. This case underscores the importance of early detection, multidisciplinary management, and comprehensive counselling for families facing Hydrops Fetalis. To wrap up, let's summarise our discussion. Hydrops Fetalis is a complex and multifaceted condition that requires a deep understanding of its causes, diagnosis, and management. Early detection and intervention are key to improving outcomes, although some cases like Alpha-Thalassemia major present significant challenges. As we wrap up this episode, remember that every case of Hydrops Fetalis is unique and demands a tailored approach to care. Thank you for joining us today on Med Madness. Stay tuned for our next episode where we will continue to explore critical medical topics to help you ace the USMLE Step 2. If you found this episode helpful, please subscribe and don't forget to share it with your peers. Until next time, keep studying, stay curious, and take care.